If you're over 50 and frustrated about having to use eye drops every day for glaucoma, there's a new treatment that could help you. January is Glaucoma Awareness Month, and Dr. Mark Stevens of Key-Whitman Eye Center joins me with some good options designed to lower eye pressure for glaucoma patients having cataract surgery. Good morning, so good to see you.
Hi, thank you for having me.
Love hearing about all the new stuff that's out there. It seems like there's something new every week.
Yeah.
Can you briefly explain what glaucoma is exactly and how it's traditionally treated?
Sure. So glaucoma is a disease that affects about 3 million Americans a year. It's essentially a high pressure inside of the eye. And that pressure over time does damage to the optic nerve, and patients will get a slow, painless vision loss over time that they don't notice until very late in the disease. And so that's why it's so important to come in for your yearly eye exam so we can pick up on those things early. It'll allow us to treat the pressure and prevent any further damage. Treatment is centered around glaucoma drops, and oftentimes that can be many drops, many times a day. It's quite a burden to patients sometimes, but we have some new exciting treatment options.
Okay, so what are the options?
Sure. So during cataract surgery, we can perform a couple additional procedures where we're putting almost microscopic stents into the filter mechanism of the eye. And putting those stents into that filter will naturally bring the pressure down in the eye. And really for people with mild to moderate glaucoma, a lot of times we can get them off their eye drops completely, or at the very least decrease the dependency on the eye drops.
Wow, that's exciting.
Yeah.
Is it covered by insurance?
Yes, so typically both Medicare and the commercial payers will cover this procedure as long as it's performed during cataract surgery.
Okay, so we all know how expensive prescriptions can be. How can viewers find out if they're candidates for this or other procedures? What do people do?
Well, they just need to call and get an appointment. We have 9 offices throughout the Metroplex now. I practice primarily at our Richardson and our Rockwall locations, and then all our surgery is done in our Dallas Surgical Center. But if patients would call, we'll get them into whatever office is most convenient for them.
So I want to mention one more thing. You know, I have had some problems with dry eye, and so I came into your office and went through the whole eye exam that y'all do. It's a very, very thorough exam. When should people start that? How often should you have it done, and what kinds of things do you catch with that?
Well, we like to see people yearly, and typically we pick up a lot of patients in the mid-40s when people are starting to need those reading glasses and they come in worried about their eyesight. We're able to pick up on diseases early, such as glaucoma, where we can treat it early and prevent any sort of vision loss over time. What we don't want to see is patients that come in late in the course of a disease, something we could easily treat it earlier.
Okay, good advice. Thanks so much. Good to see you today.
Thanks so
Call
much.
214-220-EYES. That's 214-220-3937 for more information. Or you can just go to keywhitman.com to schedule an appointment to get that eye exam. We'll be right back.